Hello friends, I am Dr. Rohit Kaushal. So today we'll describe you about a condition known as phimosis. Now phimosis is a very common condition which we see in today's younger generations who come to us to clinic to seek treatment. So first of all, what is a phimosis? Phimosis basically means any person who is unable to retract back his foreskin, the skin which is overlying his pen is a loose fold of skin. That is known as phimosis. The causes could be either because of some infection or either because of by birth that person is having a tight foreskin or because of some sexually transmitted infections, and sometimes in older age groups we find cancer as the cause of phimosis. So how to diagnose phimosis? Phimosis diagnosis depends solely on the clinical examination. Only a specialized urologist or a surgeon can diagnose it in his clinic, in which he is unable to retract back the prepuce. Now, what are classical symptoms of phimosis? Why do patients come to clinic to seek treatment? Mostly these are younger patients who had onset of sexual activity and then they find that their skin is not retracting back and they're facing difficulty while having sexual intercourse, or while urination they're having ballooning of their foreskin, or sometimes they're having frequent multiple small cracks or cuts on their foreskin while attempting intercourse, or they have some deviation of their or curvature of their penis during erection. So coming on to the treatment of phimosis is purely surgical. There is no medical treatment for phimosis in adults. As far as children are concerned who are less than 4 or 5 years of age, most of the children they have phimosis below 4 years of age, but mostly they come out of phimosis and they recover on their own either with some local lubricant jelly or with some steroid cream application. But patients who have this problem persistent even after childhood days, they will require treatment sooner or later in their adulthood life. So currently today in our armamentarium we are having 3 techniques by which we do the process of circumcision, which is the prescribed treatment for phimosis. Number 1 is the conventional technique. In this technique, the tight foreskin is cut with a scissor or a knife, and the remaining skin is stitched back with some absorbable sutures. So these sutures they automatically self-dissolve on their own within 3 to 4 weeks time and then they heal naturally. The second technique is the laser technique. The laser technique, the skin is cut with commonly the diode laser or the carbon dioxide laser. In our clinic we are mostly using the diode laser at various settings, and we cut the skin with the laser and then the remaining skin is again stitched back with some absorbable sutures which again heal in 3 to 4 weeks time. So now what is the advantage of a laser technique over the conventional technique? Laser is a purely bloodless technique in which there is minimal to no blood loss from the skin edges. The healing is perfect. Time consumption is minimal. It's hardly a 10 or 15 minutes procedure. It causes minimal pain and faster recovery and faster resumption of normal activities. The third technique is the stapler circumcision technique, popularly known as the ZSR technique. In this, a special device which is known as a stapling device is available, in which fits directly over the glans, the top portion of a penis, and cuts the skin sharply and staples back the remaining skin. So there is no use of any stitches absolutely. The staples are actually a biodegradable staples which automatically fall off within 3 to 4 weeks time, and it heals with minimal scarring. However, the stapler is not applicable in very small children or in patients who have a very severe tight phimosis. Otherwise, stapler and laser techniques are in today's world the most advantageous in terms of outcomes. Thank you.